The coronavirus pandemic is posing an unprecedented challenge for humanity. Since the arrival of the virus in Turkey in early March, Ankara has taken tough measures to prevent the spread of the disease. The Turkish government, along with a consortium of 4 local companies, has undertaken an initiative to domestically produce ventilators, which are a critical part of the treatment process for patients infected with COVID-19. We sit down to talk with Selcuk Bayraktar, Chief Technical Officer of Biocar, and Cemal Erdogan, General Manager of BioSys, about their role in this endeavor. Mr. Selcuk Bayraktar, Biocar's Chief Technical Officer, and Mr. Cemal Erdogan, General Manager of BioSys. Thank you for setting aside time for us during these very trying times for Turkey, as the coronavirus pandemic has impacted not only Turkey but also many countries throughout the globe, and we're seeing many changes to our normal way of life as people are now being isolated. We're seeing lockdowns, people using masks on a day-to-day basis. So I want to thank you for setting aside time during this very trying period. Mr. Bayraktar, my first questions to you. When you think of the name Selcuk Bayraktar in Turkey, the first thing that comes to mind is drones, a pioneer of Turkey's drone program, a very important centerpiece of the Biocar company. Whether it be the TB2 or whether it be the upcoming Akıncı drone, very important achievements. But right now we're here to talk about ventilators, a ventilator that your company is part of a consortium in producing. Now, can you take me through the process how Biocar went from producing drones to being part of a consortium that's producing ventilators?
So thank you for visiting us for the interview. When the pandemic started in the world, a lot of countries, as you know, the disease causes pneumonia, and a lot of the countries in the world urgently needed ICU ventilators, and people were dying because of that. Luckily, Turkey has a lot of intensive care units and ventilators compared to most of the world, but again, when the pandemic came to Turkey, when the virus reached Turkey at the beginning of at the month of March, we said, you know, we need to do something about this because the disease might spread more quickly, or it can do more harm maybe. So there was uncertainty there, and a lot of the countries were suffering because they didn't have medical ventilators, especially ICU type ventilators. And this we have a very advanced technical background. I mean, we have engineering disciplines, 7 different engineering disciplines working together on high-tech drones. So as a humanitarian mission and as a citizenship mission, we since we're engineers, we said we need to do something about this. So with the help of the Ministry of Technology and Industry, we found that there was a company, startup company, which was already working on ICU ventilators in Turkey, and which had came a long way in the last 5 years. They had been able to produce 12 ventilators, which were already in use in hospitals in Turkey. So we said the world needs ventilators urgently. Turkey might need them urgently. What can we do? We have a very, as I said, you know, technically we have a depth in a lot of different engineering disciplines. Since there's a company that already does them, but the need for extremely fast mass production, plus if the device, since these are complicated devices, I mean, they're called mechanical ventilators, but they're not really mechanical. They're computer controlled devices, and What's if you want? If someone asks me what's a medical ventilator, it's really a computer program that's controlling a set of complicated actions, valves and monitoring and doing respiratory functions, complicated respiratory functions.
That's what it requires right now. We're looking at this period, this very troubling period for the world, and everyone needs to help everyone. Now, I'm looking at this consortium. I see Aselsan, a defense giant. I see Arçelik, a white goods manufacturer, publicly traded, with exports to Europe, Asia. I see Biocar, a company that now has become a household name with the developments in Syria and in the region with its drones getting much publicity. And then I see BioSys, a name I've never heard before, a startup company. Tell me a little about BioSys and how did it become part of this consortium?
Actually, we started this project 9 years ago with the Ministry of Science and Technology. They granted us a foundation to found a company to develop this mechanical ventilator device. Then we have advanced to develop and validate our products in 4 years ago, and we went into market for 3 years. Then our devices are in use in private hospitals in Turkey. When this pandemic starts, then Mr. Bayraktar and Mr. Fatih Kacır leads this consortium, and suddenly we were found ourselves in this consortium with our know-how.
What is BioSys's role exactly in the consortium? What does it provide with these other three big companies? What type of responsibilities does it have?
There are three giants, as you say, but in another path. There is no any sophisticated. These respiratory systems are very sophisticated field. Then Biocar is doing very well in aircraft field. Aselsan does very good jobs in defense industry, and Arçelik is a giant in manufacturing, mass manufacturing. But there is no sophisticated know-how about respiratory systems. Then we get into this project with our respiratory systems know-how. So that's why we are here now, because we have very talented engineers and medical ICU intensive care units doctors in our team. So that's why we are here now.
Biocar is a defense company at its core. So you walk into the office one day, behind you, programmers, engineers, and you tell them, guys, no more drones, we're going to produce ventilators. What's the reaction of the employees, and how close is the technology, the engineering between drones and ventilators? Was it hard to make that switch?
Well, we make robotic aircraft. These are basically robots, human-controlled robots. There are differences in technology, but again, it's just like if you were to compare the technology in medical ventilators versus drones, we have robotic systems. We have systems of complex systems interacting with each other inside the aircraft, which are all computers. There's like 40 different computers in Bayraktar TB2. In Akıncı, there's more. There's like 60 different computers basically flying the aircraft. And those are all interconnected with computers on the ground, which are human controlled. So here you have a system which is only one computer, but it controls complex set of valves and monitors certain parameters of the patients and the respiratory system. and it again does control, computer-based control basically, and humans, control the machine, certain parameters, the nurses and the doctors. So if I were to compare this technology to a drone's computer, in a sense it's different, and but it's not like anything we didn't do before. I mean, we do much more complicated interactions between different computers and design these computers and design the aerodynamics. But here, of course, it's a different field. I mean, the medical side, in the first place, is a different field. It's a human respiratory system. There's aerodynamics involved, but it's different aerodynamics. There is mechanical, pneumatic systems involved, but they're different. But again, the fundamentals are the same. But since BioSys has already developed a device, and the time is critical here, we need to adapt the technology extremely fast to verify it in the first place, and to put in place if there were certain developments necessary. For example, this disease required a special treatment method that required a mode change in the devices. Cemal Bey was working on it actually. So those were all verified. The circuits, the electronics were all verified and redesigned together with Aselsan, and the software was verified line by line, and some of its parts were rewritten. Some of the documentation that was not there was also taken in hand by our engineers. But the approach of our engineers to the problem was everyone wanted to be, and that's again true for the rest of the consortium, everyone wanted to be a part of this team because they saw it as a humanitarian mission, and everyone had a heart in this. So at one point, engineers from our team were working on a valve that was export restricted due to the fact that it was being used in a ventilator. So we had to produce those too, redesign and produce those. So they were working on it, and again, what makes the problem here challenging is a time issue. You need to spend countless hours on problems and that you don't know when you're going to solve. It's like writing a poem, but you have a deadline, and the deadline is very short. You need to design something real fast, but design is inspiration. You don't know when the inspiration is going to happen, but there's a deadline. You need to meet that. So they said, lock us into the room. Some of the engineers are friends. Lock us into the room and don't let us get out till we finish this job. So that was the attitude. And everyone, we are like 850 people. Aselsan is way bigger than that. There are like 8,000. I'm not sure about the number, but as Biocar, we were like 40 people working on this project. The rest of the engineers all wanted to be a part of this project because the reason is, I think, simple. It's our civilization's values come from, compassion.
Mr. Bayraktar is talking about how challenging the time constraint is now. The Turkish President Recep Tayyip Erdogan said he's expecting delivery of 5,000 units by the end of May. That's a very tight deadline. Can this consortium meet that deadline?
This project is involved with 3 giants and a startup company. Then I believe that we can handle with this big number, because everyone is crafted with their pets. Then we believe we can handle with this big number. And furthermore, we can do much more than this. Then we can, I believe, our health ministry and our president will support the developing countries. Then we can do much more than.
Mr. Bayraktar, now, again, drones to ventilators. Is the medical sector, the health field, something that interests Biocar in the future? Can this be a new direction, a new branch for the company?
4 years back, we were working on a device that was a mobile ECG device, electrocardiogram device. There was none in the world. My father suffers hypertension, so he needs to monitor it. He carries a tension, blood pressure device on his arm all the time. He needs to check regularly, maybe like 50 times a day, his blood pressure. So we said, we came with the idea, the biomedical devices are a leading tech sector in the world right now, wearable biomedical devices. We started on a project, worked on it for almost 3 years to make a mobile wearable device. Again, there was a consortium. One was a banking company and one was a university. We worked together on that project, a wearable device that was actually, there was none like it at the time. That could basically monitor your your movements, your motion, plus of course it's a mobile ECG with diagnostic level accuracy. It could monitor it and broadcast that data to the to your doctor or a healthcare system. It was highly developed technology. There was challenges there too, but then our partners continued on their own on that project. So this is not the first time that we're working on a medical project. But for the future, the foundation of Biocar was a company that manufactured automobile parts. It's an old company, it's a family business. My father founded it in 1985. It's almost 40 years, right? Almost there, it's like 35 years. So our love for aviation, my love for aviation kind of drove the company in this direction.
This project has also gotten a lot of publicity for the company as well. It's making its name heard. Have BioSys received any offers, foreign companies, or opportunities outside of Turkey's borders as well?
Actually, we received a lot of demand from outside, from foreign companies. We want
even foreign countries. A lot of interest. A lot from all over the world. There's
very huge demand, and we replied them kindly to take their demand and inform our Ministry of Health, and so there are a lot of demand.
You said that these ventilators are medium to high range. Can you see your ventilators one day in hospitals in New York, Shanghai, London?
Yeah, I hope so, because we have a good team and a good consortium here, so we can advance shortly that segment.
Now, President Erdogan, during this period, he's helped many other countries, up to 40 countries Turkey has sent humanitarian aid, medical aid to, and the recent reports say that over 100 countries have applied to Turkey for aid as well. Is this consortium that Biocar is a part of just manufacturing these 5,000 units that are going to be delivered for Turkey, or is there plans inside the government or inside the consortium to also produce more for other countries as well and help people throughout the world that may need ventilators? Because from what I've seen following the coronavirus, a ventilator is a very key aspect of the health process in keeping patients alive, especially during that period where they're intubated when it's a life or death scenario. So will we see these ventilators throughout the world? Will they be part of these health packages that Turkey's sending to many of these other countries?
Well, of course that the decision is for the government to make, but as far as we see, Turkey, in terms of ICU beds, intensive care unit beds, and in terms of fighting with the disease has been extremely successful, and we have the per cap, we have the one of the highest number of per million people number of ICU beds plus ventilators, and as far as we've learned, many of those, so we have excess in terms of medical devices and ICU units. Turkey has a very strong health care system. Example for the world. I think I've lived abroad, for many years, and I haven't seen such a social, strong healthcare system elsewhere. So Turkey has set a good example in social healthcare, and again, I think that lies the reason again lies at the foundation of our civilization, mercy and compassion for the humankind. There was countries all over the world. I cannot, I don't want to name them, but nevertheless, all over the world, Western developed countries, all around the world. There was since we started the campaign, there was so many orders coming from all around the world. So this is a high-end. I mean, this is a very sophisticated ventilator. More modern, more advanced than most of the ones that are already being used. So they could be used anywhere in the world, from the most developed countries to poorer parts of the world. And I think, and at a very, since this was done on a humanitarian, all humanitarian basis, I think the price could be, probably much more affordable than even the rest of the world.
Okay. We're running out of time, so one last question, quick answers from both of you. You mentioned the doctors, the healthcare professionals are heroes. Is Biocar, is BioSys, is this consortium a hero?
Well, compared to what they've done, what our healthcare professionals have done, we are just supporters of them. And again, I'm the head of the T3 Foundation, which aims to develop, build the high-tech infrastructure of Turkey, especially by doing projects in education. We have DENEAP, Maker Lab type of educational programs all around Turkey. And we organize a big festival, the biggest aviation festival in the world. Last year it was held the record number of attendees. 1,750,000 people came in to the. It's a technology and an aviation festival. So we have a startup summit there too. We have students, competitions, technology competitions, all across the spectrum, from designing rockets to unmanned taxis, and we are trying to promote the ecosystem that gives the opportunity to companies like BioSys, so that other products can come. So we are very happy to see another example, and we are very happy to support an example, a company that has founded from ground up and has started, was able to develop the technology. Now is producing ventilators that are all across the globe. So that's such an excitement for us.
Do you view BioSys, or this consortium, what they've achieved, what they're going to achieve hopefully in these upcoming months? Are you a hero? Is BioSys a hero? Is this consortium a hero for Turkey?
The actual heroes are our health system employees. We are supporting them. Without our health system employees, our efforts is useless. Actually, they are real heroes.
Thank you for your time. I mean, when I look at what both your companies are doing and what they're a part of, I think it's a very important contribution to the Turkish health sector, and who knows, maybe in the future to the international health sector. So thank you for putting aside some of your valuable time during this troubling period with the coronavirus. And thanks again.